Hey, Niklas here from AidPlan. Maybe you've read some of the testimonials on our website from both men and women. But I would also like to tell you a story about a patient in this video and how he healed himself by participating in our online program. Paul was 38 years old when he contacted us. That was around the beginning of March 2020, just before the start of the COVID-19 pandemic. Today, Paul is healthy again, but we are still in contact by email. His story is inspiring for so many people affected by chronic pelvic pain syndrome, which is why I want to share it with you. Paul contacted our clinic because of severe pain in the genital area. He described it as a burning sensation in the urethra, which sometimes even spread to the entire perineal area and testicles. Sitting for long periods of time was hardly possible because the pain grew and spread to other areas, including his back and buttocks. Unfortunately, Paul worked in a phone customer service for a bank, which required a lot of sitting. At the time, Paul had been suffering from this pain for 2.5 years, and to put it mildly, his quality of life was severely impacted. While the burning, painful sensation went away at night, it would come back suddenly every morning and increase throughout the day depending on his stress level. He also experienced bladder weakness and painful flare-ups after an ejaculation, which of course affected his sex life. And Paul was in a committed relationship at the time, and while he was open and honest with his fiancée, his symptoms weren't exactly conducive to their relationship. Paul found AidPlan almost by accident. During a visit to his, fifth urologist, he learned that pelvic pain can sometimes come from the lower end of the vertebrae. And so Paul ended up with us and our online program via Google. You should also know that after 2.5 years of pain, Paul had not only seen 5 urologists, but also a family doctor, a proctologist, and a naturopath. Then there were the painkillers. 4 courses of antibiotics, alpha blockers for 6 weeks, 2 cortisone courses for 8 weeks each, as well as common over-the-counter painkillers for the bladder and other medicines that he could no longer remember. Nothing helped. Paul was really desperate, and it's understandable. Well, it was clear to us that since doctors had ruled out any infectious or bacterial causes, the symptoms clearly pointed to pelvic pain syndrome, which for men is also called non-bacterial prostatitis. A urologist had even given him the diagnosis, but only prescribed common suppositories, which did very little. So how did AidPlan help? First, Paul started doing this stretching exercise I gave him, 30 minutes a day, every morning. And after only 3 days, I got this exciting email. Niklas, it's gone. Although he then wrote that it was only 80% gone, he experienced a relief he hadn't felt in months. But then, 2 days later, came the next message. The pains are back. Well, I have to say I know how effective some exercises are, but I thought it was too good to be true. To have pain subside after only 3 days of exercises is rather unusual. So we wrote back and forth, and I explained to him that this is completely normal and that setbacks always come and should even be expected. The whole pelvis and all the tissue around the bladder, the prostate and in the pelvic floor must get used to the new relaxed state. Well, after about 4 weeks in my program with the daily exercises, he sent a new update that his pain has decreased significantly and to his great joy could only be felt in the genitalia area. It had stopped spreading and urinating felt normal again. But he still hadn't achieved complete relief because he could still feel a slight burning sensation. Well, I then invited him to my practice to check him again for trigger points, or in other words, hardened tissue areas. And although Paul assured us that he was doing everything right, ta-da! With the trigger point wand, I found an extremely painful spot at the base of the groin. In fact, it was a common spot for genital pain, and I was able to actively treat it on site using gentle pressure. 2 days later, we received the next message. He was now back at 30%. For the first time, the symptoms were not always constant. The burning came every now and then, and it sometimes squeezed his bladder, but there was no comparison to before. I then re-emphasized that the importance of skin rolling in the lower abdomen and pubic bone area, as I explain in detail in my online course. I told him to focus particularly on that treatment area again. And then, after another 3 or 4 weeks of dedicated commitment to our treatment, we received the happy news: Paul's pain was completely gone. While he sometimes felt a mild tingling after lying on the couch for a long time, he considered himself cured, and he was so incredibly happy. This was just 2.5 months after he started our online course. Paul's story illustrates how incredibly unnecessary it is to suffer. It was only through a holistic treatment, by releasing trigger points and by stretching the right muscles, that the cause of Paul's pain was eliminated. The same pain Paul experienced, thousands of men and women are experiencing right now. Now, we often hear the protest: that can't be the cause of my pain. I'm young and extremely athletic. Well, at the beginning of his symptoms, Paul was in the gym 3 times a week and could easily run a half marathon. So, if you have already been to the doctor and a specialist has ruled out infections or other causes, then take a look at our 12-week intensive program. Get active, do the exercises every day and see what happens. With that in mind, stay healthy, take care of yourself and your body. We see you soon again.